Afternoon, everyone. Thank you for joining us for another one of our live video chats here. Today, I am joined by April Priest with the Hamilton County Health Department and Mark Smith with Miller and Martin. Thank you both for being here today. We're going to kind of go through the sort of guidelines that are out there for reopening that we're aware of up to this point. Sort of a caveat to give everyone up front here. Some of this is fluid at this point. We probably will not be able to answer questions about every specific business type that's out there, but we're going to answer everything we possibly can, and we'll try to refer folks to places where they can get some answers in every case that we can. We'll have the Q&A up from the very start, so please feel free to go ahead and start asking questions in there whenever you want to. I'll be vetting those and we'll return to them throughout our talk here today. But why don't we kick things off here with Mark with a quick sort of overview of the guidelines that are in place right now.
Thank you, Jeremy, and good afternoon, everybody. As Jeremy said, I'm a lawyer at Miller Martin. I spend a fair amount of my time working on state and local government relations issues, and I guess more relevant to this call, I serve on the Chamber Public Policy Committee. And I'd like to put in a quick plug for the great work that the Chamber does through the Public Policy Committee. Justin Grainert and the whole Chamber team have done a fantastic job of keeping up with the federal, state, and local implications as we've worked through this crisis as a community. And so I'd urge you to feel free to take full advantage of your membership and reach out to them, and they do provide some fantastic resources. Today's presentation is actually really timely, more timely than I realized it would be when I agreed to be a part of this. There have been a lot of questions in this area, and just as of yesterday late afternoon, we're now starting to get some good clarifying guidance. There are actually two recent executive orders, one from Friday of last week and one from just yesterday afternoon, that answer many of the questions that we know Chamber members have had. And I'm glad to be on the program with April. She's very much the star of the show in terms of some of the practical realities and the guidelines and how they might impact business. As Jeremy said, this is still very fluid, and we are all doing the best we can to keep up with these new requirements. As a lead-in, I'm going to spend a little bit of time just giving you background on the various orders that led up to where we are today. And if you've had trouble keeping up, you're not alone. I've been working in this space for probably 20 years, and at no time have I seen this amount of activity on this many substantive, very critical community issues like we're seeing right now. Just to give you a sense of how unprecedented the times are, I look back through the number of emergency executive orders that Governor Bill Haslam entered in the 8 years that he served as governor of our state. And Governor Lee is about to catch up to him just in 2 months, in less than 2 months. And so a number of moving parts, a number of executive orders. We'll walk through them, and I think you'll see the progression, the ramping up, and now eventual scaling back of the various requirements. It all started March 12th when the governor declared a state of emergency. In that order, and that's Executive Order 14, you can find it on the Secretary of State website for anybody who wants to read along or look at this after the call. But in that order, the governor declared a state of emergency and began taking measures to enable the state and the medical community and others to deal with the crisis that was heading our way. It was on March 2nd, though, that he entered the first order that dealt with some of the social and business restrictions that we're now working our way through. It was Order 17, and in that order, he prohibited social gatherings of more than 10 people. He limited restaurants and bars to drive-through and carry-out type services, closed gyms and fitness centers, limited visits to nursing homes and similar type facilities. The next day, he entered Order 18, which had the effect of limiting some elective healthcare procedures, both medical and dental. And then about a week after that, in Order 21, he expanded upon the business closure order and expanded that order to cover what are called close contact personal services, barbershops, various salons, entertainment and recreational venues, which would include theaters and amusement parks. The same day he entered, this is March 30th, this is Order 22, he entered a Safer at Home order, which had the effect of closing off public access to certain non-essential businesses, and he urged, but didn't require, Tennesseans to stay at home unless they were engaged in essential activity or essential services. And those two terms, essential activities and what it means to provide essential services, have really generated a number of questions. If you go to the executive order, you'll find more than 25 categories of essential services and further definitions of essential activity. And on April 2nd, with Order 23, those urging requirements, the Safer at Home order, became a stay-at-home order or a shelter-in-place type order. And in that order, Governor Lee required Tennesseans to stay at home unless they were engaged in essential activities or providing essential services. That stay-at-home order was set to expire on April 14th and April 13th. The governor extended that stay-at-home order until April 30th. Meanwhile, for those of you who either live or work in Chattanooga, you know that during the same time period, Mayor Burke was entering some executive orders as well. The first was an emergency proclamation similar to what Governor Lee had done. He also limited restaurants and closed gyms. A later order expanded some additional requirements relating to mass gatherings and other business closures. And then, I guess most recently, Mayor Burke entered a shelter-at-home order of his own, and that order has been extended several times and was set to expire over this weekend. In the middle of the month, the governor and his team began to start focusing on how we're going to have a phased-in restart of the economy, and he created an economic recovery group, which was comprised of cabinet-level officials and various businesses, healthcare leaders, and other leaders in the state to develop a process to return to work. And that group's activity really led to the guidelines and two executive orders that are the topic of today's conversation. On Friday of last week, that group released some universal guidance for businesses in Tennessee, and then also some specific guidance for restaurants and for retail. And that same day, Governor Lee entered Order 29, which amended his business order closure and had the effect of letting restaurants open up in facility dining, with the recommendation or the expectation that restaurants will follow the ERG guidelines. Now, and this is where it gets a little bit interesting for us in Hamilton County. The way that order was set up, the guidelines are the expectations for 89 counties, but where a county like Hamilton has its own health department, that county was given the authority to establish guidelines of its own, to adopt the guidelines that the ERG had recommended, or to make other changes. Yesterday, the ERG built on that order and also released guidelines for gyms and fitness centers and how they could reopen. And late yesterday afternoon, about 4:30 Eastern time, maybe 5 o'clock, the governor entered Order 30, which really established now the statewide plan that we will be working to understand and operating under on a going forward basis. And in that order, of course, the governor continues to urge Tennesseans to be cautious as we start down this road, to follow the state and other guidelines. That order does leave in place most limits on social gatherings. It does leave in place the closure order for certain close contact services, entertainment and recreation. It does leave in place the order on non-emergency health services, which is set to expire tomorrow, and it's in effect through May 29th. But like the other order, it establishes rules for the 89 counties, but gives the Hamilton County Health Department the leadership role in determining whether to follow those guidelines or to adopt other plans or rules of their own. And so with that, I'll turn it over to April to start talking about the guidelines and what we know and what may be on the horizon.
Well, good afternoon, everyone. I just want to say it's a pleasure to join you all today, and we're all becoming very accustomed to these Zoom meetings. So I'm wondering in the future if these will catch on even after we kind of stop these stricter social distancing recommendations. I think a lot of people are enjoying these days working from home. Okay, so here at the Hamilton County Health Department, we have also received a plethora of questions and concerns from the community regarding reopening businesses, restaurants, and retail stores. At this point, we're really kind of hugging with the governor's guidance and following exactly what he is saying. And we're going to see as the situation progresses, as businesses start opening, and as we start to get more testing results, if we're going to change anything. At this time, because as Mark mentioned, these guidelines came out yesterday afternoon, we don't see deviating from anything drastic from what the governor is recommending, but we will be able to have more information as the situation progresses if we're going to change anything. We're also learning as we go along as well. This is uncharted territory for all of us, including our administration, and our first priority is definitely to keep the community safe, and we are keeping in mind that businesses want to reopen and they want to be able to serve their customers as best as they can. And so we are doing a lot of one-on-one working with a lot of businesses regarding this guidance. We have a hotline set up. It's 209-8383, and you can call and post a question, and we will either answer it there if we're able to, or we will kind of triage your question to myself or some of the other staff members at the health department to see if we can delve a little bit deeper into your issue. So know that resource is out there, and we're looking forward to working with you. We definitely want this to succeed, and we want you to be clear on what we're expecting of you as business owners and managers, and we also want you to feel comfortable and kind of going through all of this guidance from not only the Tennessee pledge that the governor's office released, but the plethora of guidance from the Tennessee Department of Health and the CDC. So we are available to answer questions. And at the end of this, I'll give you my contact information as well, and feel free to reach out to me. I try to be as timely as I can in responding, but could be a business day or so for those one-on-one meetings, but I might be able to give you a quick answer if I can through the email. So I was kind of hoping to start off here with some talking points I had set aside on some recommendations I have for you when you're opening up. One of the things that I think is really important is that you, as business owners and managers, set up a clear employee training to go through this guidance with your staff. And I encourage you, if you can see this, to print off a copy yourself of the Tennessee Pledge, Reopening Tennessee Responsibly. You can find it on the tn.gov website. It's very easy to read. You don't have to have an MBA to go through this, so they did a good job writing this for all audiences. And one of the things, some of the highlights of this guidance you're going to find from the governor's recommendations are, the first thing you might find is talking about this Families First illness policy. And this is basically showing that employees are able to take an extended leave of absence if needed to take care of themselves if they have COVID symptoms or their immediate family members. And the governor also asked that businesses write in their sick policies and procedures guidance for coronavirus and have employees sign that guidance saying that they are not going to come to work sick. And I think the best way to implement that as an employer is to actually have an in-person training. One of the things that we see is that people are just overloaded with information right now, and you can't expect to just always send people emails and that they're going to read all the information that you want them to capture or really digest the entire message. And it's important so that we can keep businesses open that you do digest the entire message and all of these safety guidelines. Sometimes we have better luck if you explain things verbally to people, and we still are encouraging you that you have to keep those social distancing rules and guidelines while you're holding these meetings, but you might want to consider holding like a just-in-time training for staff that are rotating in when they're coming back to work, or maybe doing a Zoom meeting if you have a large staff at your offices to go over face-to-face these guidelines. And we want to you and are encouraging you when you're doing this to encourage people to know where they can get information from. We know that your employees have people grab information from Facebook, they have it from national news sources, and right now it's really important that you're getting information from your local media sources, specifically our website. The Hamilton County website has up-to-date information. We even have a special link for business resources. We have a hotline that anyone can call, whether you're an employer or an employee and you have concerns. Anyone really is welcome to call that. It's open every day from 8 a.m. to 6 p.m. and on the weekends from like 10 to 2 and 10 to 3. We also update our case numbers, if I already said this, every day by 2 p.m. So you always can look and see the most up-to-date information to see if we're having an increase in cases in our county or a decrease, or the amount of people that have recovered from coronavirus. And if you're looking for more of a state snapshot, you're welcome to check out the tn.gov health website. And they also every day at 2 p.m. update their coronavirus statistics. So those are a few immediate local resources you can grab and really get an accurate picture of what's going on. We know that we're close by Alabama, we're close by Georgia. They have their own guidance, they have their own procedures, and it's important that your employees have a place to come to and get accurate information for coming to work right here in Hamilton County. And with that being said, the next thing that I hope that you stress to your employees and yourselves is to make sure that everybody really understands the signs and symptoms of coronavirus and what to do if your staff were to become symptomatic at work. As you'll notice in this pledge, one of the things that they expect employers to do is to start screening their employees every day before they come into work. And some of the questions that they're going to ask right away is, have you, as an employee, been in close contact with someone who has a confirmed case of coronavirus? And if you have, you need to report that to us immediately. This isn't the answer that most people want to hear, but if you have been in that close contact, you need to be quarantined back at home for 14 days from your last day of exposure. If you have questions about what is a close contact and do I qualify as a close contact, again, you can call the hotline and we'll be happy to go over that case by case. In general, it's within 6 feet for more than 15 minutes. So that's definitely people that you live with, and most of the time people that you've worked with. And again, we'll be happy to go into further detail about that with you if that situation arises at your place of employment. We know that that's going to create quite a pickle with some staff members who have already had to be off for several weeks and now are told when they get screened to come into work that if they had a family member that is currently positive with corona, that they will have to go home. But that's something that you as employers will have to kind of think about how you're going to handle that in advance and in these first few days of reopening. Another thing is that we're encouraging you to ask everybody if they feel okay. If you have to be point blank, are you sick? Some of the questions they ask is, do you have a sore throat, fever, any respiratory symptoms, and do you have any vomiting or diarrhea? The list of symptoms for coronavirus has grown significantly since it started. At first we just classified the symptoms as cough and cold, and now we have kind of expanded on those symptoms. And so you'll need to make sure that you're doing these things and keeping your employees' privacy in mind. We suggest that you have an HR person, handle this and talk with them individually. And if you do find that an employee has either symptoms or has a close contact, you want to keep their information as private as possible. They still have rights as an employee, and we're going to do everything that we can to make sure that none of their personal information gets released to the other coworkers. If you do find somebody that is symptomatic, they need, and the guidance goes into this as well, they need to immediately be asked to leave the premises, and we encourage them to call their physician or go to another medical provider, preferably not the emergency room. We really want to stress that the emergency room really needs to be set aside for medical emergencies. You can call the health department if you don't have health insurance, and we might be able to direct you to some urgent cares or to some other physicians that work with people who are underinsured or don't have insurance, and you can call the hotline again to get that information. We can't guarantee that that will work out for everybody that calls, but know that that is an option. And if you have an employee who is symptomatic, currently the Hamilton County Health Department is offering free coronavirus testing Monday through Friday from 9 a.m. to noon at the Bonnie Shire Admission Center. Right now it is appointment only, but we're trying to ramp up our efforts, hoping as soon as the beginning of next week we can offer no appointments, and people can just come at their convenience between those hours. And you are able to get a free test, free results, and you would be able to find out for sure if you had coronavirus. Now, with that being said, I know we've had some discrepancies in employers calling us and people saying that their employer is making them, after they have had coronavirus, get a test to show that they no longer are positive before they can return to work. And I want to stress that the coronavirus test only captures one small point in time. One of the problems with this is you could, on Tuesday, go in and get a test and it could come back negative. Go back on Thursday, get a test, and it could come back positive. But after you turn positive, it's hard for, it still is showing up in some of these PCR tests for weeks afterwards, even after the person is recovered. And so this is going to be quite a challenge as employers. It's going to be hard for you to implement and say that you have to have a negative test to come back to work, because your employee might have several weeks with testing PCR positive, even though they have already met the requirements for their isolation, which would be 72 hours afebrile with no medications, or 7 days from the onset of symptoms, whichever one is greater. So it has to be at least 7 days, and out of those 7 days, 3 of the days have to be no fever for what that means, not taking any Tylenol or anything to bring down your fever, and an improvement in some of those respiratory symptoms. And again, that's another question. If you want more information on, you can call the hotline and we'll be able to assist you in kind of delving through some of that. And we know that this is like, oh my goodness, it's going to be a lot of headache for your HR people and for you, but definitely we'll have to start planning on how you're going to handle these events, and also keep the information of your employees safe. And so those are just a few things to start off with that we're recommending that you plan on. And we think that if you just are up forward again in this training that I recommend that you do for your staff, and explain to them that, you know, we're not trying to be difficult, but this is what the guidelines say. We're going to have to do this for everyone, making sure that whether you're a manager or your staff, they see that everyone is being treated fairly. Everybody is going through this screening process. We recommend that as employees enter to work, they have a thermometer, point touch thermometer that one of your HR persons does, and they take the temperature, preferably like on the face somewhere. You don't have to touch the person. And anything over 100.4 is considered having a fever, and then you'd have to send them home. Doing these things should increase the cooperation from your staff, and also helping to make sure that we're following these guidelines set forth in this Tennessee pledge. Some of the other things that you will find in this Reopening Tennessee Responsibly document is that we are encouraging people to wear masks. And we know that we've already received quite a bit of calls in the hotline from people saying, well, I don't have a mask. And we're in a national shortage of personal protective equipment. How am I supposed to provide masks for my employees? If you would like, at the end of this, I can send you the homemade mask guidelines from the CDC. A homemade cloth mask would be sufficient for employees to wear, and you need to enforce that they do so. And if they see you as leadership wearing masks, it'll also help the people below you cooperate with these rules. And monitoring compliance is key in all of this. When we start getting calls from people complaining, because the hotline is open also if people are complaining that other businesses are not following the guidelines. Even when we were in the stay-at-home order, we received multiple calls from people saying, you know, X, Y, and Z business is open, or X, Y, and Z business is not, practicing social distancing, and we do investigate those calls and give guidance and then follow up within our powers to enforce that this is taking place and to make sure that the community is staying safe. If we become lackadaisical about this and we do not follow these guidelines and we see an increase in case, it's really going to hurt everyone. We really do not want to have to reclose everything again. This has been detrimental on our local and state economy. We know that our unemployment numbers are, skyrocketing. Over 400,000 people have filed unemployment claims. And we want to do everything that we can to keep people back at work, but we have to have people cooperate. So we're in for, a long journey, and when we're opening up, we need to make sure that people understand that this is not recovery. We are not yet in recovery. We are still very much in response mode. We, are still having, people are still contracting coronavirus. We don't know if there's going to be a second wave. We don't know, how intense it's going to get with everything reopening. We're just still trying to do the best that we can with the information we have. And the only way for us to move forward as a community is, to comply with these rules and regulations. And let me see. I wanted to give you a few tips on some of the cleaning your facility policies. If you look through the reopening responsibly guidance from the Tennessee Pledge, you're going to notice that for restaurants, they want you to clean the surfaces at least every 2 hours. And of course, every table and chair needs to be sanitized after each rotation, including wiping off menus and wiping off, making sure that all of the silverware are in paper napkins or disposable silverware. And, we know that restaurants are usually, most of them, already really good with cleaning after each person leaves the table anyway. They have a lot of experience in making sure that they're already wiping down these counters frequently. So we're hoping that they are going to be, easily catch on to this guidance. And if anyone needs any more assistance with this, it's probably hard to see through this, but know that the CDC has a very short and easy to read cleaning and disinfecting your facility guidance. And they talk about the bleach solution that you need to use. And they also link to the EPA approved emerging viral pathogens, and that works against coronavirus. That EPA list has 392 approved cleaning products on it. So I will let you delve through that on your own time, but know that that resource is out there, and you still need to make sure that you're following industry guidelines. And that's something you'll need to work with your corporate office, or you can call our health department's environmental section, and we can assist you in kind of looking through some of that information. But back to this cleaning and disinfecting your facility list from the CDC, they have very practical steps on cleaning the high-touch surfaces like your doorknobs and countertops and faucets and sinks and toilets, to the soft surfaces like your carpets and rugs and drapes and some of the other soft surfaces you might have in your establishment, and information on laundry, and even what to do if you actually have someone sick in your facility. That's a question that we've gotten a lot. Well, what do I do if the person that was in office 2A tested positive for coronavirus and I'm the employer? What kind of extra things do I have to do to clean that? They have some guidance there about opening the door and windows, waiting 24 hours before you go in that room if possible, and how you should approach cleaning that area. And again, if you have you feel like that this guidance is not going deep enough or you need more information, that's a commonly asked question, and that's probably one of the most frequent things that we've assisted people with and kind of delving through some of that guidance. And with that being said, just know that we're adapting these business guidelines. We know it's going to be challenging for you, and again, just reiterating that we're here to help. And if you other than that, I don't think I've pretty much talked straight for about 30 minutes now, so I'll pause and ask if you have any questions. but again, we are here for you, and know that we want to help you, and we're going to be here with this hotline and here for questions for the long haul. So again, my name is April Priest. I am the emergency management planner here with the health department. Right now I'm serving as the liaison as well, and I will have my uh, email address at the bottom, and you're more than welcome to contact me.
Okay, thank you, April. Some really good, useful information in there. I think I'd like to start by clarifying a couple points and then maybe get into some specifics, if that's okay.
Yeah.
You mentioned masks. So are you recommending that employees wear masks the entire time that they're at work?
If you're going to be around even one other person, I'm recommending that you're wearing a mask the entire time. If you're alone in your office with the door closed, I could see that you would take off your mask for, you know what I mean, a few minutes. But anytime you're going to be with another person, yes, I'm recommending that you wear a mask.
Okay. Are we still recommending that people stay 6 feet apart when possible?
Yes, and thank you for bringing up that point. Social distancing, enforcing that is more important, than ever right now. We want to make sure that the break rooms, people are not congregating to smoke cigarettes together, that they're not eating lunch together at the same table, if possible. We know that if restaurants are going to be open and people are going to be eating there. We know that sometimes staff members are going to want to eat lunch together, but still try to keep as much space as possible. And if you can stagger breaks more, build that into your internal schedule of people going to lunch, and that way you have not everyone coming in and out at the same time, and people are not all in the line to use the microwave and all touching the refrigerator. And it's, small decisions like that can make a big difference in the workplace.
Okay. You also mentioned screening, and specifically having a questionnaire that you run employees through.
Mm-hmm.
Are are you recommending that businesses basically have their employees respond to a questionnaire before they come in every day?
Yes, and I know that that can be tedious, but I think for the time being, that's the only way to capture all the information on a consistent basis. Because on Monday, you could not have a fever or feel sick, and if you don't ask that question again until Friday, they could say, "Oh, well, actually on Wednesday or Thursday, I started getting a headache, or I have a mild sore throat, but I didn't think anything of it." So asking every day really promotes consistency. We can gather more results. And if you note, one of the questions on there is still, does anyone in your household have, symptoms of coronavirus, or are they confirmed positive? And we want to make sure we're capturing that as well, because we know people have their own personal lives, and, their home and living situation could have changed, where someone in their household could have gotten sick, and maybe they didn't want to share that information at work, but maybe this is an opportunity to capture that.
Okay. Um, let's talk some specific industries at this point.
Okay.
Restaurants.
All right.
Um, are there still limits on capacity for those?
Yes, we are saying that no more than 50% capacity in the restaurant, and it is tables have to be at least 6 feet apart from each other, and no more than 6 people at one table. So we're still going to no parties of 8, 10, people eating dinner together. Unfortunately, 6 is the max, or fortunately, depending on how you are looking at it. People per table, and to figure how they look their dining rooms to accommodate these recommendations. I know some people have booths that are already, kind of grounded in the floor in certain locations, or they can't move for whatever reason in their dining room. But unfortunately, then you'll have to have more than 6 feet away. Regardless of the situation in your establishment, you'll have to find a way to make it work. And I don't mean to sound harsh, when I say that, but compliance is crucial in this.
Sure. And just like with every other business, we would recommend that all employees there be wearing masks and gloves in the case
Mm-hmm.
of a restaurant.
And and again, thank you for bringing that up. There's actually videos, and I can send you a infographic on how to change your gloves correctly. not only do we want people to wear gloves, but we need to make sure that they're changing their gloves on a regular basis. That's not, wearing the same gloves all day is going to, be worse for you if you didn't have any gloves on at all. And there's actually a way to, change your gloves appropriately and then wash your hands before putting on new gloves. We know that you're not healthcare personnel, so this isn't the same, strenuous process that they have to go through, but know that there are guidelines out there for changing gloves and your face mask. You don't want the face mask to flip back on your face and have any soiled material. But again, we understand that you're not, ER physicians.
Sure. Um, and we do have a question here in the Q&A.
Okay.
What determines the capacity of a premises?
So the capacity is determined by what the fire code has already established, and I believe that that's written in the guidance as well. So if you had a capacity of 200 that the fire marshal already, told you, then that means now your capacity is 100. And so you'll have to find that out that should be printed in the safety instructions in your actual facility and maybe on some facility exit plan. And most establishments have that actually visible for people to see, and you'll have to accommodate based on that.
Which brings up another question I think that I've heard raised once or twice when we're talking about capacity versus the seating guidance. Regardless of what the 50% capacity is, the guests also must be set 6 feet apart, right?
Yes, so even if you have a 200 capacity and 50% of that saying that you could have 100 people in the building, if you still can't seat people 6 feet apart, then you can't have 100 people in there. You can't just meet your capacity and say, well, we met, the first part of our, guidance by only having 100 people. It really is all or nothing. You need to be able to comply with both 50% capacity and still having people 6 feet away from each other.
Okay. What about retail? Are there specific guidelines outside of what we've already talked about that we are asking retailers to take at this point?
Yeah, one of the main things that stood out to me about the retail portion of this guidance was making sure that we have a dedicated entrance and exit way so that the same people are not passing each other when they're coming in and out, and creating this plastic barrier was the second one, so that customers and clients are not so close together that droplets are being exchanged. And that is also outlined in one of the bullet points, and I believe it's page Tennessee Pledge guidance. We also are asking that you ask your customers to wear masks when they come in, and you are, perfectly able to enforce that. You can put signs on the door and, make it very pleasant for your protection. And ours, we're requiring that you wear a face mask, before you come in. And even with the face mask, we're still saying you need to, try to do your social distancing within there. With retail, it's a little different. Obviously, you're not placing tables. But you can kind of zone where people are walking, and again with the separate entrance and exits and signs, and again they also have a 50% capacity rule is there as well, so it should limit the number of people that are roaming around the stores.
Okay, and we have some more questions coming in. I do just want to say for folks, if you have specific health-related questions, we would refer you back to a physician for that. Questions about determining what sort of symptoms are okay to go to work with. Again, that's a question for your physician or your employer.
And also, again, call the hotline because we can talk a little bit more to you about, we're saying that if you have any of the symptoms, you know what I mean, such as, we know that it's allergy season, but if you feel that you can't really tell the difference between allergies and coronavirus, just from basing on talking to someone. So if you have an employee that's sneezing or coughing or has any of the symptoms, I would still encourage you to send them to get tested. That'll at least give you an instant time spot that today while they were coughing, it is because they had, seasonal allergies, and then we can move on from there. But I wouldn't take any chances. A lot of people have felt that they had allergies and then they were positive for coronavirus. So the guidance is clear. If you're symptomatic, you need to go get tested and leave the premises. And if it does turn out to be allergies because of a negative test result, then we can, go from that at that point.
And how quickly are results coming in at this point?
If you get tested through one of our either the Bonnie Shire or the Riverfront testing sites, they're about 24 to 48 hour turnaround time. So pretty quick.
Okay. Um, are you supplying any help to find hand sanitizer and/or gloves and other PPE?
We are going to attempt to host a mask campaign, and we're going to request that community members donate like the homemade masks, and we are not sure how that's going to work out. We don't know the amount of people that will actually donate these, and then how we're going to distribute them out has not been decided. A few weeks ago, we had a ton of people that wanted to donate masks, but they specifically wanted them to go to healthcare personnel, and we were not allowed to take them for that, and we didn't want them to waste their time sewing them or their resources on the fabric and elastic if we weren't going to be able to accept them. We're reapproaching that issue. But because people can make their own masks with a t-shirt, we are saying that you're still able to do that. There's also bandanas that you can use. There's all kinds of creative solutions. So we cannot guarantee you that we're going to be able to provide you with PPE. And we want to encourage people to not call us and rely on that. If you can't find those things and we're not able to provide them for you, that's not going to be an excuse for you know what I mean, not following the guidance. If you, unfortunately, if you can't find the items and you can't comply with the guidance, then you probably shouldn't open up. And I know that that's kind of a tough pill to swallow, but the state has prioritized who gets PPE, and the top thing is our hospitals and healthcare facilities. So this isn't us not wanting to provide things for you. We would love to be a bigger resource in helping out with some of these PPE needs, but any resources that are requested from the state are triaged into priority groups and then redistributed based on those priority groups. And the local health department does not have a stash of PPE despite what everyone's thinking. We have things enough to carry us through our normal operations, and we ourselves have already had to request on multiple occasions pieces of PPE. So I guess the simple answer is no, but that doesn't mean that we can't try to link you if we know that somebody has some PPE for sale, or link you to places that we've found that may have homemade masks for sale, or hand sanitizer, etc. But no, we're going to do our best to try to assist, but you do not take that as we're going to be providing you PPE, because that's simply not the case.
Okay. We'll take another couple questions here really quickly, and then I know you have a hard out, April, so we'll wrap up here fairly soon. Is live music allowed in restaurants as long as they are adhering to the distancing protocol?
No, unfortunately, the live music is definitely not allowed, and neither is the bar being open. And both of those things are outlined in the Tennessee Pledge and in the governor's. It's not in the pledge. It's outlined in the Executive Order 30 that Mark Smith mentioned earlier. At this time, they're not bringing that back yet.
Okay. If an employee has symptoms, should they be told to call their physician or the health department, or both?
They should be told to call their physician, and then if they're going to call us, it's only so we can direct them to a testing site. We do not offer primary care for most people, but we can direct you to the hours and operations of a testing facility. And know that right now that's totally free. And like I said, when that changes as far as the hours of operations, it'll be broadcasted on the site right now. Everyone, you're able to go get tested, and hopefully next week you won't even have to have an appointment. You can just drive there or walk up and have that done.
Okay. And a question for you, Mark. You mentioned the newest guidelines that just came from the governor's office, and that would be sort of what we're following for the near term as we start to open things back up. Are you anticipating further orders coming from there, or changes being made to this as we go forward?
So, Jeremy, I do think that the Lee administration, I think there are really two answers to that question. First, I think the Lee administration, the Economic Recovery Group, will continue to address, provide guidelines in the future. For example, we still have businesses that are closed, such as barbershops and salons, and I would imagine that the economic recovery group would play a leading role in that. And then remember what we talked about earlier, that the health department, under the current order, is also a source of guidance. And so I can't really speak to, as between the state and the health department, who will do what when, but I do understand that the economic recovery group will be issuing some further guidelines as other businesses are opened up.
Okay, which sort of leads to another question here. How long do you all anticipate that testing sites will continue to be open as we move forward?
Oh, I'm sorry. We do not have a date on when we were planning on closing the testing sites. We know that it is a state priority and a local priority to test as many people as possible for as long as possible. We are constantly undergoing surveillance efforts and ramping up our surveillance and monitoring. It's our primary strategy in controlling the spread of coronavirus. And so we do not plan on any time soon, and we're getting much more efficient and better at guys. And the state has also really been working hard to, give us the testing supplies, which was kind of the holdup at the beginning of the incident. And so we are planning on continuing these testing efforts as long as we can.
Okay, so key takeaways for everyone today, I think, continue social distancing efforts as much as possible. Even though we are reopening things, people need to act responsibly as much as they can. Wearing masks, taking all of these precautions that you mentioned, April, if you are going to be in your workplace, and just continuing to monitor as we go. And I think you just shared your contact information in the chat there, April.
Yes.
We will make sure and include that when we push the recording of this after the fact, so people can get in touch with you if they have more questions. And a good resource for them would be to go to the Hamilton County website.
Yes. You have our information. We always have our up-to-date, not just the hotline information, but we have our our results posted there. And also we have links for businesses and anything that has to do with our testing sites, hours of operations, and if that changes for any reason, all of that will be posted on the website, and it's very easy to navigate. So please use that as a resource.
Okay, thank you so much, both of you, for doing this.
Hey,
I think this
thank
has
you.
been really useful information for everyone, and we really appreciate your time.
And thank you for having us. I hope you have a pleasant afternoon, and good luck everyone on reopening. And again, we're here for you if you have any questions, and we want you to succeed. So please use us. We're happy to help you. So thank you.
Thank you.